Chapter 2 by Dr. Kashif Shakil. In this lecture, you will learn equipment, infection control, and clinical setup for wet cupping, Hijama, learning objectives. By the end of this chapter, participants will be able to identify all essential equipment required for wet cupping, understand the principles of infection prevention and control, prepare a safe and professional treatment environment, apply standard precautions during every procedure, demonstrate proper handling of sharps and contaminated materials, follow biomedical waste management guidelines, maintain patient safety throughout the treatment process. Introduction. Wet cupping is a minor invasive procedure involving skin incision and blood exposure. Therefore, infection control is not optional. It is a professional and ethical responsibility. Many complications associated with wet cupping are not caused by the procedure itself, but by poor hygiene practices, improper equipment handling, and inadequate infection control measures. A practitioner must understand that every patient should be treated using the same safety standards regardless of age, gender, diagnosis, or appearance. The objective of infection control is to protect the patient, protect the practitioner, prevent disease transmission, maintain professional standards, reduce legal and ethical risks. Essential equipment for wet cupping. 1. Cupping cups. The cups create negative pressure and collect blood during the procedure. Always use disposable plastic cups. Selection of cup size should depend upon treatment area, body structure, patient comfort. The practitioner must inspect every cup before use to ensure there are no cracks, defects, or contamination. 2. Suction device. A suction pump is used to create negative pressure. The practitioner should ensure proper functioning, adequate suction. No leakage, clean condition. Faulty pumps can compromise treatment, effectiveness, and patient comfort. 3. Scarification instruments. Scarification involves creating superficial skin incisions. Recommended instruments: sterile disposable surgical blades, sterile disposable lancets. Best, benefits no skin scars. Important principles: single use only, open immediately before use. Never reuse. Dispose immediately after use. Reuse of sharps is unacceptable and poses serious infection risks. 4. Skin preparation materials. The treatment area should be disinfected before the procedure. Common antiseptic agents include povidone iodine, 70% isopropyl alcohol. Clean and disinfect the cupping site with an antiseptic before starting the procedure. Proper skin preparation significantly reduces microbial load and lowers the risk of infection. 5. Personal protective equipment, PPE. PPE creates a protective barrier between practitioner and patient. Recommended PPE includes disposable gloves, surgical mask, protective apron or gown, eye protection when splashing is possible. The amount of PPE used should be based on risk assessment. Treatment room requirements. A professional treatment room should be clean, quiet, well ventilated, well illuminated, easily disinfected. The room should create a safe environment for both practitioner and patient. Treatment couch. Preparation before each procedure. Clean treatment couch. Disinfect contact surfaces. Replace disposable covers. Ensure patient comfort. The treatment area should allow easy access to emergency equipment if required, maintaining an aseptic field. Sharps safety. Sharps injuries represent one of the most significant occupational hazards in clinical practice. Biomedical waste management. Wet cupping generates clinical waste that may contain blood and biological material. Improper disposal may expose staff, patients, and the community to infection risks. All waste should be managed according to local biomedical waste regulations. Emergency preparedness. Every clinic performing wet cupping should be prepared for unexpected events like vasovagal syncope. Key clinical principle. A skilled practitioner is not judged by the amount of blood removed, but by the safety, cleanliness, and professionalism with which the procedure is performed. Patient safety must remain the highest priority throughout every wet cupping session. Thanks for watching.